it. So he appeared on the TV stations defending a statement that vaccines cause mental illness. And then his advisors, I think, got the bad, advised him, you're going to sound like a kook. So then he tweeted a picture of himself getting a revaccination for measles. So he wants to be... So then, guess what? We talked about Semmelweiss doctrine and hand washing. Another guy decided on Monday, right after the lecture, he was going to appear on C-SPAN and say it should be voluntary whether or not healthcare workers and food workers wash their hands after they go to the bathroom. Should government tell people that they have to wash their hands? Shouldn't they have personal freedom to get other people sick if that's what they want to do? Well, do you have personal freedom to shoot other people? You know what I mean? When do you have personal freedom to drink and drive? When you endanger other people, it's not personal freedom, it's intruding on the rights of others. Coexist. So, but now it's become a politically hot topic. And once it becomes political, that means what was a 99.9% of the population believes it versus 0.1% are kooks. All of a sudden it comes closer to 50-50. So it's going to now be a political issue. Should food handlers be required to wash their hands after they go to the bathroom? Should somebody with hepatitis be working as a food handler? Or is it their personal right? Or if they have typhoid, you know the case of typhoid Mary? Well, anyway, there's a lot of cases like that. So it's become a hot political topic. So maybe this will be an issue in the next political campaign because it looks like political candidates are already weighing in on whether or not government should enforce health policy. All right, so read the little story about and view the videos, and you can go to YouTube. I'm sure there'll be new things appearing there all the time as the semester goes on. There's a lecture here that basically is this lecture from a previous semester, so if you want to view that, you can look at that too. That's what we're going to be doing today. All right, what are the differences between a psychiatrist? Psychiatrist is a person that gets an MD degree. And then they do a residency where they are a doctor supervised in a psychiatric setting. So they do a supervised psychiatric residency. They can prescribe drugs. That person can do surgery and all the other things that an MD can do. So this is an MD with extra training and extra experience in the field of psychiatry. What is a psychoanalyst? Now in the old days, a psychoanalyst had to first be a psychiatrist and get an MD degree, and then go to a school of psychoanalysis. But then the schools of psychoanalysis are falling out of favor. I'll explain to you why. And so they lowered their standards, and now they're allowing PhDs or even people with PsyD degrees, another type of doctorate, to go to schools of psychoanalysis. They also get psychoanalyzed themselves. So if you're going to be a psychoanalyst, you have to be psychoanalyzed. If you saw The Sopranos, you saw the way the media reports on, so you all know about psychoanalysts. Are there lots of psychoanalysts in the world? At the most, there were 2,000 at one point in history, 2,000 psychoanalysts. There aren't very many of them. On the other hand, you've all seen them if you watch television and movies and things like that. The media loves to have stories about psychoanalysts. The psychologist goes to a university where they grant a PhD in psychology. So they get a PhD. That's a doctorate that involves research. Most of them have nothing to do with clients or patients. So these people see what you could call patients or clients that they're dealing with clinical problems. Most psychologists do research or teach at universities or work in industrial settings. You saw a description of all the different kinds of psychologists. Some universities have a clinical program and some do not. So we have I'll divide them roughly into clinical and not clinical. So other areas, and there are lots of other areas: biological psychology, cognitive psychology, mathematical psychology, psychometric psychology, industrial organizational psychology, school psychology, social psychology, developmental psychology, and on and on. There are many other areas. And there's clinical, which is the most closely related to these two, and a person in clinical gets a PhD in clinical psychology. Some universities have clinical programs, some universities don't believe in it. For example, in the state of Kansas, Kansas State University has no clinical program. University of Kansas has a clinical program. UCLA has a clinical program. For a long time, UC San Diego had no clinical program. Among clinical programs, usually they produce PhDs who then do a supervised traineeship working with clients under a person who, so clinical psychologists are the ones dealing with clients, people that have problems, behavior problems or mood problems or other kind of problems we'll talk about later. There's also some people get master's degree and get in the state of California. They can get an MS degree, and we have a program like that here at Cal State Fullerton in clinical. And these people can get a marriage and family therapist license in the state of California. Different states have different rules, different licensing rules as to what's required. Typically, exams are required. A degree plus exams plus a supervised traineeship are typically what's required in most states. Some states don't have regulations. The state of Oregon has been in flux with respect to regulations involving use of the word psychologist and what you have to do to say you're a psychologist and charge people money for treatments. We'll talk about that in a bit. So these are all things that are in chapter 1. How many got that the psychiatrist, the biggest difference here is psychiatrist has an MD degree. Okay, so you should have mentioned that. They can prescribe drugs and do surgery, whereas a psychologist who does not have an MD degree, just has a PhD degree, does not practice medicine. They don't do surgery, they don't prescribe drugs. Now sometimes you have situations where a psychiatrist or another MD will have a psychologist working with them. Psychologists may interview the people and make recommendations to the psychiatrist about what drugs to prescribe, but it's actually the psychiatrist that's prescribing the drugs. But it may be that a psychologist is giving a recommendation. So you have situations like that. But these people ordinarily wouldn't be doing medical things like electrical shock or insulin shock therapy or drugs or surgery. And we'll say more about these various other kinds of treatments. And as I say, the psychoanalyst, this is a person that typically had an MD degree and then went to a school of psychoanalysis where they studied basically the techniques of Freud and his followers. We'll talk more about Freud. How accurate? This is just a matter of opinion. I'll say more about the personality test later. You've been reading the chapter, for most of you, it's chapter 13. So let me clarify this. Somebody asked a question that chapters 13 through 16 have been assigned for this week and next week, but not social. What I meant is I'm not assigning the chapter called social psychology. Since you're allowed to use different editions of the book, for some of you the chapter called social psychology is in chapter 13. For some of you it's chapter 14. For some people it's chapter 16. So you read everything from 13 to the end of the book except chapter on social psych, but it won't injure you to read it now. We're going to read it later. So we'll be covering that later in the course, the chapter titled Social Psychology. If you have a question about that, you can bring me your book if you have trouble figuring out which chapters to read, and I'll show you the chapter called Social Psychology. You can read that later. And we will do that. That'll be later. All right. I'll say more about, you've been reading, for most of you, it's chapter 13, the chapter on personality. That will talk about personality testing, and I'll say more about that in a bit. Semmelweiss is the doctor that told doctors to wash their hands. Doctors and healthcare workers should wash their hands. What's the first rule of medicine?
Do no harm.
Do no harm. That's the first rule of medicine. Do no harm. How old is this rule? Thousands of years old. At least 2,000 years old. And it's the first rule of medicine. There's the Hippocratic Oath, do no harm, going back to the days of the Greeks, ancient Greeks. Semmelweiss realized the doctors were actually harming people, and they could prevent this by washing hands. Now it's becoming a political issue, so we're going to have to worry about it, about what the politicians might decide to do. We're losing about 100,000 people a year in U.S. hospitals from infections from one particular bacterium, MRSA, methicillin-resistant Staphylococcus aureus bacterium, is a bacteria that was created in hospitals through evolution by the overuse of antibiotics. And it lives in hospitals, and it's transmitted from patient to patient or from surfaces in hospitals that haven't been cleaned to healthy patients. So you go in for one reason, the doctors don't wash, or nurses, or the food carriers, if they don't wash their hands, they can transmit this bacteria to you. And how many people in U.S. hospitals? The estimate is 100,000 per year. How many people died as a result of the terrorists on 9/11? About 3,000. Bioterrorists are killing 100,000 a year just from this one bacterium alone. And I recently saw an estimate, and I want to look this up, that iatrogenic effects, which means accidents in hospitals and other bacterial transmissions, other things you didn't have, things that are called complications. When you read in the newspaper, somebody died from complications of something, that means that the hospital killed them. They died from something else they didn't have when they went in there. Hospital gave them an infection. Like, let's say you go in for hernia surgery because you're getting a weakness in the muscle. You got a torn muscle, it opens up, your guts are pushing out, you know, there's this bulge in the skin. They decide they want to do a surgery and repair it. They're going to cut open the skin, repair the muscle, and sew you back together again. You get an infection, you die from that. You died of complications of a hernia. Okay? So complications means you died as a result of harm done in the hospital. But I saw a recent estimate of 400,000 Americans killed a year in U.S. hospitals by harm caused by the medical system. So one of the rules we want to worry about, first principle of medicine is do no harm. We want to worry about that in psychology as well as in medicine, and that's part of medicine. So Semmelweiss was a person trying to reduce the harm that doctors might do, and what was his solution? Doctors should wash their hands. How many got that right now? Hopefully most of you, so that was a big feature of the last lecture. Most people don't seem to have known who Semmelweiss was ahead of time. You should know who Semmelweiss is and what the Semmelweiss doctrine is, washing hands, and keeping clean. We'll understand more about that later when I compare the history of medicine and the history of psychology. What's wrong with the theory of unverifiable brownies? What was the problem with it? Well, you remember I lectured on the theory of unverifiable brownies. They exist, existence, completeness, action-reaction, otherwise inertia, competitiveness, right? Dominance, fringes, all the principles of brownies. What's wrong with that theory? You guys like the theory? You didn't like the theory. She didn't like the theory. Brownie made her shake her head. No, maybe she did. Yes.
It was meaningless.
Meaningless. That's the problem. What's the criterion for meaning? You can test it. If you know how to test something, you know what it means. So meaning of an empirical statement is how you test it. If you don't know how to test it, if you can't test it, then it's meaningless. If you can test it, and you understand how to test it, then you know what it means. So if I say to you, there's a brownie under this stack of papers, you don't know what it means because there isn't anything you can do to test it. If I say there's a $1,000 bill under there, you can imagine doing things to test it. So when I make a statement that you can imagine testing, and you can construct, and there may be many, many different things you can do to test it, so it might have a lot of meaning. Something has a small meaning, maybe it's just saying some simple thing. You know, a statement like there is something here is a much simpler statement than whenever I drop this. That's a generalization. It's a much bigger empirical statement because it refers to a lot more than simply there's a pen here. There is a pen here now is much simpler statement, has less meaning than a statement there's always a pen here. There will always be a pen in this room. You know, will there always be a room here? So if you don't know how to, if you can't test it, if it's a logical contradiction, be like a bachelor being married. Is it logically possible for a bachelor to be married? No. If it's logically impossible to test it, contradiction to say you could test it, it's meaningless. So something that has no way, if it can't be tested. Now when I say again that it can't be tested, I don't just mean it would be hard to be tested. Or in our lifetimes we can't test it, because somebody can make statements about something happening in the Andromeda galaxy 200 million light years away. We're not going to live 200 million years. We're not going to know. If somebody said something just happened in the Andromeda galaxy, why, we wouldn't get light to show us that it happened for 200 million years. So somebody said, well, that can't be tested now. We'd have to wait a long time. But imagine somebody could test it, right? It's not a contradiction to say you could fly faster than the speed of light. That's just empirically impossible. So it might be empirically impossible to test it. It might be impractical to test it. It might be technically impossible, but it's logically possible, so you know what it means. If I said that a star went supernova, you understand what I'm saying, because you understand how you would test it, even if you couldn't live that long. So I mean it can't, in principle, be tested. It's a contradiction to say it could be tested. So it's meaningless. So hopefully you got the idea that it's meaningless. And a theory should have meaning. It should be testable. And that's in chapter 2 of your CALET that you should be reading about, chapter 2, about the idea that a theory should be testable. And he also is going to talk about Freud's theory with respect to that criterion. What are the criteria for an explanation? Well, the first one is deductive. You should be able to deduce the things to be explained from the theory. Second one is it's meaningful. And what do we mean by that? We mean it's testable. It's not meaningless. And the third criterion is predictive, which means that if you'd known the explanation in advance, you would have predicted it. Okay? And there are 2 more, causal and general, and we'll say more about them in a bit. Any more questions about the quiz? How many got the idea of meaningless? Okay, a lot of hands, good. And again, in this class, you're not in danger of raising your hand to get the right answer. Okay. Any questions about the quiz here?